also co-chair the Survivorship and Palliative Care Task Force with Carlin Calloway, who's also here with us today. This is our third webinar in our Food Access and Built Environment webinar series, and we are so excited to be able to dive into exploring built environment in urban settings today. We'll be having our fourth webinar in our series later in July, focusing on rural environments as well. So today we'll be exploring the ways in which built environment affects all parts of the cancer experience for Coloradans, from screenings to diagnosis to treatment to survivorship. And we're really starting to see this be talked about and researched a bit more. We'll share a research article with you a little bit later, kind of talking about how food insecurity and cancer screenings are linked. Next slide, please, Ian. We might back up to that one if our interpreter arrives. So the Colorado Cancer Plan, the goals and objectives through it is really what we're trying to hit at with this webinar series. So a couple of our different goals really relate to built environment and kind of understanding how the cancer experience is impacted by different aspects of built environment. So looking at decreasing the prevalence of overweight and obesity, how our walkability and bikeability impact physical activity among residents in Colorado. Next slide, please. Our objectives 8.1 and 8.2, which really focus on survivorship, also talk about physical activity among cancer survivors and caregivers, and mental health and emotional and physical well-being overall. So we're really looking at trying to increase education about these things and access to physical activity, and really wanting to kind of demonstrate to all of you how we can kind of all come together and help advance the Colorado Cancer Plan. So our objectives for today, next slide. So we'll really be looking at the concept of built environments. Steph will be talking shortly and just really kind of give us a kind of terminology and understanding of this. We'll look at how built environment again impacts cancer prevention, diagnosis, survivorship, and palliation in an urban setting. Again, we'll be focusing on rural settings as well later. And to articulate how an individual might impact their built environment. So we know that folks across Colorado are interacting with these systems on a daily basis, and there are things that we can do to help impact it in various ways, whether from an individual or organization level. So we'll dive into that a little bit later. We're going to have some open discussion after the presentation, and just encourage you to be kind of thinking about these things as we go through the presentation. They can be a little bit hard to make some of those connections, so that's what we really hope to do here today. All right, and we'll turn it over to Steph.
Great, thanks. Thanks, Ian. Hi, everyone. My name is Steph Leonard. I want to thank the Colorado Cancer Coalition for inviting me to participate in this webinar, and many thanks to each of you for tuning in. So I'm a built environment coordinator with the Colorado Department of Public Health and Environment. My background is in both public health and urban planning, which is suiting because I often describe my role as an urban planning position within the state health department. Today, I hope to increase your understanding of how the built environment relates to public health, specifically within the realm of cancer, and also open up a conversation about ways that you can help bring about built environment change to help improve health outcomes in your communities. Next slide, please. So first and foremost, I recognize that the term built environment may be new to some of you. So I wanted to take a moment to establish a common understanding for us all. The built environment consists of the spaces and places where we live, work, learn, and play. The built environment is an important component of public health because our daily experiences determine our physical, mental, and our social well-being. So that's our grounding definition. Again, the built environment is the spaces and places where we live, work, learn, and play. Next slide, please. So we can take a look at the Colorado Cancer Plan for some context. The plan calls attention to some key built environment themes that we'll discuss in more detail today. The design of the built environment influences our daily experiences, which again determine our physical, mental, and social well-being. Built environment design decisions directly impact factors like air quality, substance use, diet, physical activity, and cancer screening, which all have overall impacts on overall cancer risk and specifically related to breast cancer, lung cancer, and colorectal cancer. Built environment design can make it easier for people to be physically active, eat healthy, and connect socially as a part of their everyday routine. And then the final theme that we'll kind of touch on in a presentation today is that built environments, while they can promote health, those that enhance health are not equally distributed in our community. So we experience, oh, I see that our interpreter might have joined. So I'm going to pause so that
Thank
we
you, Steph.
make sure we get interpretation going.
Yes, I'm going to get this set up. Okay, folks, I'm going to stop sharing for just one brief moment so that I can see what I'm doing. Maria, are you with us?
Looks like she's connecting to the audio.
Welcome, Maria. Can you hear me? Can you hear me, Maria? Apologies, folks. While we're getting this started, if for interpretation, at the bottom of your toolbar, you should see a globe icon. If you open that up, you'll need to select your English or Spanish channel. I will select English. And Maria, can you hear us? Maria? It looks like you can hear us. I cannot hear you. Looks like we're still having some technical difficulties. While Maria's getting set up, Steph, apologize for the interruption. Do you want to continue? Maria, if you can chat me when you are ready, and we can do that. Apologies, folks. Steph, you can continue.
Would you share the slides then?
Oh, yes.
Thanks. Perfect. So just to reiterate, the final point is that built environments that enhance health are not always equitably distributed in our communities. So next slide, please. So our built environments are shaped by policies and planning decisions that determine where and how our resources are distributed in community. So I am going to share, we have this slide translated to Spanish for everyone because it was a little too much to have on one slide. So I'm sharing that in the chat before I start to dive into the explanation. But this framework on the screen is called the Elements of a Healthy, Equitable Community. It was developed by Change Lab Solutions and demonstrates how several elements interact to form a healthy, equitable community. So if you take a look at the screen, the gray call-out boxes include elements of healthy communities, including healthy workplaces and quality jobs, health and supportive services, safe, stable, affordable housing, quality schools, thriving local economy, parks and community spaces, environmental quality and sustainability, access to healthy food, and safe, connected transportation systems. And then if you look at the bottom of the screen, you can see a note that says, together, the elements provide cumulative health and equity benefits. So the key at the bottom is describing how each of these different components relate to health specifically. So all of these elements have an impact on physical and mental health. And we want to see a mix of these elements in our communities to ensure that people have the ability to lead healthy lives. And the boxes that I've outlined in orange, those are the ones that are most directly related to our conversation today. Related
Steph,
to
can I jump in?
Sure.
I'm sorry. I figured out the issue. So I'm going to hit pause for a second. I'm going to jump back a few slides. And I'd like to introduce Maria, our interpreter for today.
Good morning. And my apologies. I had every tech issue where I couldn't even communicate with Ian about it to fix it. Buenos días, voy a ser la intérprete y les pido disculpas que llegara tarde, es porque tuve muchos problemas técnicos esta mañana, como nunca.
One moment, Maria. So folks, now is the time where I'm going to add Maria as our interpreter. And then in the globe icon on your toolbar, you can select English or Spanish.
Entonces ahora ya voy a poner a María como la intérprete de español y abajo en la barrita del menú, donde hay uno que parece el mundo, ese es donde pueden escoger, seleccionar el intérprete.
And from then on, you'll either hear English from Steph or other presenters if you're on the English channel, or Spanish from Maria if you're on the Spanish channel.
A partir de ahí estarían escuchando a los presentadores en inglés, en el original, y a María en español si escogen el canal en español.
And if you have any questions, you can chat me. I'm at the Colorado Cancer Coalition.
Si tienen alguna pregunta, me pueden mandar un mensaje por el chat. Yo soy Colorado Cancer Coalition.
Great. So you can select your channel now. Okay, Steph, thank you.
Okay. You can go ahead to the slide, the next one after this. So we can go ahead and talk about, just to help contextualize how these elements create healthy, equitable communities, let's consider safe, connected transportation systems, which are systems in which people of all ages and abilities can safely and efficiently travel by any mode of transportation to access places they want and need to go. Could you advance? So this type of transportation system can benefit communities in many ways, including increases, leading to the increase in physical activity, which has positive outcomes, positive benefits on obesity, cardiovascular disease, diabetes, and cancer outcomes. We see improvements with mental health, motor vehicle safety, economic security, food access, access to healthcare, as well as improved social connections. And safe, connected transportation systems have the tendency to help decrease asthma rates and decrease substance use, according to research. Next slide, please. So why are we just now hearing about the built environment and public health and related fields? I often ask myself the same question because both public health and urban planning have similar origins during the Industrial Revolution. So feel free to answer this question in the chat, but does anyone recognize the story that these graphics are alluding to? I'll wait a second or two. Or a name associated? Not redlining, yes, it's John Snow. So I wanted to, call attention to John Snow as just an example of how these two fields are related. Again, public health and urban planning. So in 1854, there was a serious cholera outbreak in London, and John Snow was a physician who was convinced that the outbreak was caused by something other than bad air or miasma. And so he started to map and record, and map the records of where people were getting sick, and led him to recognize, like, if you take a look at this map where all the black dots are, the source was actually a dirty water pump on Broad Street. So you see all of these dots are located around Broad Street. So in public health, this is really kind of our start of epidemiologic methods. When we first started to see the emergence of some of our existing disease tracking strategies. And then within public urban planning, we saw a development of a field for the first time in which, public health crises in industrialized cities highlighted the importance of strategically developing urban areas and laying a foundation for future land use regulations. And while both fields sprang from similar origins, practitioners ended up adopting different methodologies that led public health and urban planning to develop along parallel paths. So next slide, please. It's only in more recent decades, with the development of concepts like social determinants of health, that there has been more regular interdisciplinary collaboration. So as we're continuing to learn, health is a lot more than just healthcare. It's just one piece of the pie. So physical, social, and economic contexts account for the majority of our health outcomes, including education access and quality, economic stability, social and community context, healthcare access and quality, and neighborhood and built environments. you just click for me, Ian, I have just to make it a little easier to digest. So we see kind of the schematic of what the social determinants of health are. And then diving into neighborhoods and built environments specifically, several variables within that piece of the pie include housing, transportation, safety, parks, playgrounds, walkability, an individual zip code and where they're located within a city. These are all different, the different policies and systems related to these factors have impacts on our health outcomes. And research is showing that more and more. Next slide, please. Unfortunately, our built environments, they can be designed to enhance health, but they aren't typically, or when built environments are designed to enhance health, they aren't equitably distributed within our communities. So in both urban areas and rural areas, neighborhoods close to sources of pollution like highways or oil refineries, or neighborhoods that lack parks with safe places to play, or lack sidewalks or places to safely ride a bike, often experience negative health outcomes. So let's take Denver, for example. This map shows how the distribution of parks in Denver is related to average life expectancy throughout the city. So take a look at it. Areas with the longest life expectancy tend to have greater park access and also tend to be majority white neighborhoods. It's not the universal case, but it is a theme that we see. And this phenomenon was even called out by the New York Times in 2020 in an article referenced on the screen. It's called "Denver Wants to Fix a Legacy of Environmental Racism." So if you'd like to read that article, I can, I'm going to drop the link in the chat for you so you can have it for your reference. But you know, this is kind of the background setting, just relating to how the built environment and public health are interconnected. But on the next slide, we're going to dive into how the built environment more directly relates to cancer prevention. So there's a lot going on in the screen, so let me just bear with me. Over the next few slides, we'll explore an infographic developed by Built Environment and Healthy Living Lab that helps explain the results of a recent article published in Cities Journal. The article focuses on key links between the built environment and cancer prevention strategies, and discusses ways in which the built environment may reflect and contribute to cancer disparities. The primary factors discussed are exposure to urban carcinogens like air pollution, design factors associated with behavioral risk factors like physical inactivity, and access and proximity to screening and healthcare facilities. And then just for reference, the original article and infographic will be linked in the resources at the end of this presentation, so you can go back and take a look. Next slide, please. So beginning at just kind of the prevention level, cancer rates can be directly impacted by the state of our built environments. Many common types of cancers, such as colon, breast, and lung cancer, can be avoided by reducing behavioral risk factors, such as physical inactivity, unhealthy diets, alcohol intake, and smoking. And research demonstrates that features of the built environment can act as facilitators or barriers to healthy behaviors. For example, designing communities with built environments that reduce people's dependence on cars and actually increase access to parks and physical activity and active transportation, those can improve physical activity and lower levels of air pollution. So that helps to connect, or disconnect us from our environmental carcinogens, as well as helps increase behavior change that has positive impacts on cancer outcomes. And then just a note that they included in this infographic that I think is worth highlighting again is that the cost of living often prevents socially disadvantaged populations from living in health supportive neighborhoods. Again, those that are near parks or those that have access to reliable transportation options or alternative transportation options. So next slide, please. So to help ground you in what this actually looks like, how can our built environments be designed to support cancer prevention? One consideration is to create built environments that make it easy and comfortable for physical activity to be a daily routine. One means of accomplishing this is to focus on activity-friendly routes connecting to everyday destinations. So policy and design strategies that connect routes like sidewalks, trails, bicycle lanes, and public transit options to destinations such as grocery stores, schools, work sites, libraries, parks, and healthcare facilities. Those are proven to increase physical activity by making it safe and easy to walk, bicycle, or wheelchair roll for people of all ages and abilities. So in Colorado, we have a program actually out of the Colorado Department of Public Health and Environment called the State Physical Activity and Nutrition Program that is focused on helping Colorado communities create policies and environment change to achieve this goal. So my team at CDPHE, we work with communities throughout the state to develop new policies that can help make it easier for people to actively get to the places they need to go and want to go. And then we also keep track of which communities are making these types of changes and try to highlight those successes. And that's through the State Physical Activity and Nutrition Program. And then there's a community, since this webinar is focused on our urban environments, I wanted to call attention to Denver's Community Transportation Network program, which is a newer initiative in which Denver is really making an intentional effort to connect those everyday destinations with activity-friendly routes. So they're building out a bicycle network in 3 different parts of the city as a means of ensuring that people can safely connect on a bike throughout the city to get to parks, schools, libraries, grocery stores, transit routes, all of those types of things. And that's been an effort and that they've been working with community to design these routes. And typically when they're designing these routes, they're considering multiple modes of transportation. So while it is a bicycle network, it's also thinking about how can we improve intersections to make it easier for people walking? How can we make sure that these routes are near high frequency transit routes so that people can really be making connections that they need to make. So again, that's Denver, just one example of implementing some of these activity-friendly routes connecting to everyday destinations. But the other component I want to highlight here is not only do we want to make it easy, but we want to make sure it's comfortable for people to be able to do physical activity, because physical activity is a means of cancer prevention. And so an element to be considering in these activity-friendly routes is our shade cover and our tree canopies, because shade tree canopies can decrease UV exposure, as well as just increasing comfort while being physically active. So a resource I wanted to call attention to is the Tree Equity Score. This is something that folks can take a look at, this resource, to understand how communities, where communities might be having issues related to low tree canopy coverage and ways that we can move forward and create more comfortable spaces for people to do physical activity as a result. So that's just a resource to check out. Next slide, please. Regarding screening, diagnosis, and treatment, the built environment, and particularly the transportation system that's in a community affects how individuals access cancer screening and healthcare centers. Both geographic proximity and transportation access to these types of facilities, as well as perceived factors such as aesthetics and safety, can impact whether people are able and willing to access cancer screening, diagnosis, and treatment services, especially for populations with limited vehicle access, such as lower income populations and older adults. Next slide, please. So how can built environments be designed to support cancer screening, diagnosis, and treatment? One consideration is to ensure that people can access healthcare facilities safely and conveniently by all modes of travel. So again, thinking back to the discussion at the beginning of the presentation about safe, connected transportation systems, how can we make sure that people of all ages and abilities can safely and efficiently travel by any mode of transportation to get to these types of facilities? That looks like ensuring that there's ADA access outside of all of our healthcare facilities. While the Americans with Disabilities Act has been in existence for decades, we still see many communities are behind on implementation. So striving to increase implementation of this act and increasing access for people with disabilities, specifically when it comes to healthcare facilities. Another aspect of this is public transit networks and taking a close look at what's available. Public transportation networks need to be located with convenient routes near screening facilities. So this is more of maybe a conversation with transit planning professionals, but making sure that healthcare facilities are a key factor in deciding where routes go, as well as route schedules. So not only do public transit routes need to be accessible to screening facilities, but making sure that the times in which these routes are operating align with when people need to be accessing these facilities, and making sure that fares are affordable. I know that some states or communities throughout Colorado offer free transit, which is an incredible community resource, but then there are some communities where fares are required, and so making sure that there are opportunities for reduced fares where that's feasible, and for people who require reduced fares to meet their basic needs. And then one final piece in this story is that, again, supplemental transportation services are really crucial in helping to make those connections to screening, diagnosis, and treatment facilities. So there are non-emergent medical transportation opportunities, such as those available through Medicaid. And there are multiple service providers throughout the state that can meet community needs based on different criteria. So again, this component is much more focused on that access piece and proximity. Next slide, please. And then finally, cancer remission and survivorship outcomes are also influenced by the built environment. So survivors may rely on built environments such as public green space, for daily behaviors, or they may be exposed to environmental stressors such as noise, pollution, crowding, unsafe conditions, and physical barriers to movement. So spatial proximity in this regard is another key piece of survivorship. So going back to the transportation piece, but then access to resources that can help keep people healthy in their built environment. I know we've already gone through some series about food access, so I won't touch on that piece as much. Food access is definitely a key part of survivorship as it relates to the built environment, but I'll focus in a little more on some of these components related to green spaces and parks. But before we jump into the next slide, I just wanted to note, again, cancer survivorship tends to be lower among those living in deprived areas compared to those living in affluent areas. So again, just repeating that theme that these health promoting built environment designs are not equitably distributed. So we want to make sure we're thinking about the broad spectrum of people in our communities. Next slide. So the built environment as it relates to cancer survivorship, one consideration, again, is that parks and public green spaces increase opportunities to physical activity and social connectedness that are important for survivorship. So again, just to provide some examples of what this looks like in Colorado, there is first the Colorado Parks and Recreation Association, or CPRA, has a Cancer Fitness Institute, which exists to develop, provide, and support opportunities for quality cancer-specific exercise programs to patients and survivors in healthy and positive community environments. So this can be in a park space, this can be in a recreation center, this can, it's serving as a way of connecting cancer survivors to physical activity and to each other as a means of regaining strength and confidence. And this is where we see an overlap with some of our parks and public spaces. Another great example of how this kind of work is happening in Colorado is through the Weld County Department of Public Health and Environment and their Outdoor RX program, which is an initiative in collaboration with Thriving Weld and other healthcare providers to send patients outside for active time in nature. And so it's like actually a prescription given to community members as a means of improving their health. So these are just two examples of the many ways that parks and public spaces play a role in this picture. But then again, to reiterate, parks and public spaces are just one of the many components of the built environment that have an impact on cancer survivorship. I put a note on here, transportation access, again, plays an important role, as I mentioned. We also, as I mentioned before, food access plays a key role, and the list goes on and on. So I just have one more slide before we jump into some questions here. So I gave you a lot of information, and I hope it's not information overload. This is really just skimming the surface on how the built environment is related to public health, specifically cancer. But I wanted to give you all some tools and like an idea of how to move forward, what are roles that you can be playing in your community. So first, as I mentioned on the last slide, just the role of parks and public spaces playing a key part of the success story in cancer. So working with parks and recreation departments to develop partnerships to continue these types of initiatives that, like the ones I mentioned on my previous slide, And one way to get involved is through the Parks and Public Health Collaborative, which is a group of interdisciplinary professionals who meet throughout the year for peer learning and discussion. And, this could really be a new topic within the group's learning and professional development opportunities. So that's, a way to get started, or you can work directly with your local parks and recreation departments. Another option is developing partnerships with urban planning staff and participating in planning processes. And there's so many different ways where this can happen. If you're interested in this approach, again, I'm an urban planner and a public health professional. My role at CDPHE is to help make these types of connections. So I'd be happy to work with you on this process and do some additional learning, provide other resources. But one resource I want to call out is the Working Together, a training framework for public health and planning professionals. And this is a clearinghouse of resources developed by the Centers for Disease Control and Prevention, where if you go to this link, you can walk through the different phases of a planning process and understand how you can become involved as a health professional. Advocating for policies like health in all policies is a really effective means of making sure that some of these health promoting built environment design attributes are implemented by making sure all policies that are being developed are being viewed as an opportunity to improve health. And finally, an idea is conducting health impact assessments to evaluate the health impact of policies or specific projects. And I'll just give you a final example. The City and County of Denver Department of Public Health and Environment has developed multiple health impact assessments throughout the years and would be a great resource go to for how they developed their process and what have been the outcomes and lessons learned. So thank you. I feel like I gave a lot of information across the board, but I'd love to open it up now for some questions. And I have seen some great feedback in the chat, so I'm going to take a second to take a look at those as well. Thank you.
Thank you, Steph. You are correct. We did have a couple responses in the chat. The first one was from Paula about access to affordable transportation following outpatient surgeries. And would like to reiterate that non-emergent transportation program is something worth looking at. Depending on where you are in the state, there are different options if I understand how it works. And then both Braden and Bonnie commented that in their neighborhoods, the school is open to community after hours, nights, and on weekends for anyone to use and enjoy the space. And I was wondering, Steph, if you can maybe speak to that, because I imagine that didn't just, like, the school principal wasn't like, hey, I want to do this for my community. So how can folks, if they don't have access to that, work on that?
That's a great point. And this is public institution access like that, like schools. That is a really great approach to increasing access to physical activity opportunities for people of all ages in both urban and rural communities. So these are typically achieved through shared use agreements or joint use agreements. There are a couple different names for them. Actually, we have a colleague, Braden Nicholson, who's on the call now. She has been doing great work in collecting resources that are helpful for communities who are interested in developing shared use or joint use agreements between schools, and community organizations, nonprofits, hospitals, across the board. And there are examples of efforts that are currently going on, to try to increase access to, for example, a track and field, so that it's useful for a high school during typical school athletics hours. And then there's an agreement where you discuss, what are the liability concerns? What are the different lighting concerns, resources, like what goes into this? So there's an agreement in place, and then that allows access for older adults to come use the facility after hours, or, for children who aren't in the high school to come use it after hours. And so that's a really great tool that can be used, especially in our communities where you don't have capital funds to create a new recreation center, but you already have these existing resources available. And they can be used for programs as well. So there can be regular programming, walking groups, or physical therapy can use these types of facilities. So there's a whole plethora. If you're interested in more information, you can reach out to me, and I'll connect you with the resources we have within our team as well, on how you can get started with these types of agreements.
Thanks, Steph. Let's see. Would anyone, I'm going to stop sharing and see if we can make this a little bit more community, have a community feel. Feel free to come off of your, or come onto camera and ask Steph any questions you may have around built environment. If you have other examples of built environment you've seen in your community, we'd love to hear them, prompt further discussion like we just had. Or if you can talk about how you've seen your work impacted by built environment, whether they be improvements or areas where you'd like to see improvement. Hi, Beth. Did you have a question for us?
I don't really have a question as much as I'm not really urban. I'm very, very rural. But how do you get, when people start building new schools, get to a seat at the table to help them understand that the school is a community place instead of just it's a school in isolation? We see this happening in several communities out here, and it's difficult to get that conversation going.
Yeah, thank you, Beth. I definitely agree with your statement that schools are a community, and that they are a part of the broader community as well. So it's like, yeah, there's a sub-community, but there needs to be that integration into the larger community. I'd be happy to connect with you offline if you're running into any specific barriers, but there are several resources that can maybe provide you with some language that would be useful in planning specific processes that I could follow, and I can follow up with everyone. But the key piece being, public health professionals and health professionals are key subject matter experts in this space, and they need to be at the table. So it's, figuring out when those meetings are and attending the meetings and commenting on any kind of documents that exist. There's typically, drafts that are released for public comment, finding ways to be integrating those key statements about community base and the need for integration. I would, made a key point there, just escaped me. But I guess, what's been your process so far? Like, who are you working with, or who are the key partners who've been a part of this process?
For us out here, I don't think that we had a seat at the table at all. And everything seems to be independent and isolation. So they're building a pool and a school, but no real community center. And then it'll be interesting to see how it fluxes out. But I think really what you're saying is get a seat at that table. And I think that is probably our first step. So I see what you're saying. I think I'd like to learn a little bit more about the language so that I can go slightly armed with some information and some data and showing how it's more of a global event when you build a school or a pool or a community center. Does that make sense?
Definitely. Yeah, and I think your circumstance, unfortunately, isn't in isolation. I think many people deal with similar barriers because we do operate in these different silos, and it's like, oh, well, we know what we're doing. We don't need outside input, but it's really like, community members are the experts in how these spaces will operate. And so I don't know if it's your school board or your local or your county. And imagine maybe it's a county level project, but finding, like you said, finding your seat at the table. So that's like finding all the meetings that are coming up, and just to reiterate, my team, we exist to provide technical assistance in these kind of situations. So my team at CDPHE, and we would be happy to help you feel empowered with the language and the policy knowledge to go into these conversations. We also have access to health data that could probably be very helpful in these conversations. So I'd be happy to connect afterwards with any specifics.
Okay, thank you.
Thanks, Beth and Steph. I think we have time for one more. Carlin, thanks you for the excellent presentation. And wanted to know, how can the CC partner, the coalition partner with you to improve those who are impacted by cancer? To improve efforts for impacted by cancer.
And is this for me specifically, or is this for the audience?
I think it's for you and all.
Perfect, thanks, Carlin. So some first things that come to mind within CDPHE and my team specifically, and within the Comprehensive Cancer Program and the State Physical Activity and Nutrition Program, we have funding to actually help communities purchase equipment that will increase physical activity and improve built environments for health. So one key and easy way is just to help spread awareness about these funding opportunities. We've had great responses, actually an overwhelming amount of response this year to this funding pool. It's a small amount, it's $5,000, but $5,000 can go a long way when it's, especially in a smaller community where it's like these types of funds don't become available often. So that's one, just like raising awareness. If you have any opportunities for similar types of funding, the small projects really make a big difference because it's sometimes enough momentum in the right direction to see those small policy changes and to see new programs and to, show that this is meeting a community need. So as a teaser, our next webinar in July will actually be talking about some of these, what we call quick win projects that have been funded through the Comprehensive Cancer Program within CDPHE. But that would be, just an easy first step towards supporting this work from the coalition's perspective.
Thank you, Steph, for that teaser. Yes, so Beth, there will be on July 20th, a rural built environment presentation that hopefully you can take even more information away from. Please do take our evaluation for today. This lets us know if we met our goals for providing the information that we said we would, and also provides you an opportunity to give us other feedback. And with that, we thank you, and we will hopefully see you on July 20th for Built Environment in rural Colorado.
Thank you, everyone.
Thank you.